next we're going to talk about the intercostal spaces. Now, like I mentioned in the previous video, anything with the term costal refers to the ribs. So you can guess from the name intercostal, since inter means between, then this is referring to the spaces that are found in between the ribs. So like I just said, the intercostal spaces are spaces that are found between the ribs, and they're usually numbered according to the rib above. So the intercostal space, for example, between rib 2 and 3 would be the second intercostal space. Now, the importance of the intercostal spaces is that they are where the muscles that move the ribs are attached and located. So basically, the space in between the ribs is closed off by muscles, and these muscles are important because they're the ones that move the ribs and allow breathing movements. Now, generally speaking, in terms of muscles, all muscles in the body have 2 points of attachment. One is called the origin, and the other one is called the insertion. The origin is where the muscle starts, and then the insertion is where the muscle fibers pass to, and then it's the other end of the attachment. So in the case of the muscles that are found in the intercostal spaces, the fibers always pass from the lower border of the rib above to the upper border of the rib below. So if we take our same example where the second intercostal space was the space between rib 2 and 3, then the muscles in that space would go from the lower border of rib 2, and then they would insert or attach to the upper border of rib 3. Now, this picture is just showing you the location of the intercostal spaces, which is anything that is colored in green here. So like I said, these are the spaces that are found in between the ribs. Now, as previously stated, each of the intercostal spaces is covered or closed off by the intercostal muscles, and the intercostal muscles are 3 sets that are named according to their relation to the surface of the body, meaning that if I were dissecting the chest and then I removed like the skin and all the outer layers, the first layer of muscle that I would find would have a name, the second layer of muscle would have a name, and then the third layer of muscle would have a name. So the first layer of muscle that I'm going to find is referred to as the external intercostal muscle. So this is the first muscle that I'd find as soon as I removed all of the outer layers of the thorax. Now, these fibers, or sorry, the fibers of the external intercostal muscle, pass from the vertebral column posteriorly to the end of the ribs anteriorly. So basically that means that the muscle starts at the back, and then its fibers pass forward around the curve of the thoracic cage, and then they end at the anterior end of the rib just before the costal cartilage. So if you look at the picture here, the external intercostal muscle is anything that's in green. Sorry, my bad. Okay, you notice how it fills the space at the back here, right next to the vertebral column, and then it passes around and then ends just at or before the costal cartilage begins. Okay, so since they're starting at the back and then curving to the front, then the fibers are going to pass in a forward direction as well as downwards. So basically, if you follow the fibers, okay, this would be the beginning of the fiber, and then each fiber passes downwards and forwards, downwards and forwards. So the second layer of muscle that's found directly underneath the external intercostal muscle is referred to as the internal intercostal muscle. Now, generally, the internal intercostal muscles are the reverse of the external. So the direction is opposite, the starting point is the opposite, so everything is the other way around. In this situation, the muscle fibers are going to start anteriorly from beside the sternum, and they're going to pass posteriorly towards the vertebral column. They're still going to start from the rib above and pass into the rib below. So in this case, the fibers are going to pass downwards and backwards. So here, you've got the fibers of the internal intercostal muscle starting from the side of the sternum, and they pass from the rib above to the rib below, downwards, but they're passing backwards as well towards the vertebral column. Now, notice that with these two muscles, the internal and external intercostal muscles, each intercostal space is filled or covered or closed off by one separate internal intercostal muscle or external. So this muscle, this one is separate from this one, is separate from this one. So each space is filled by its own internal or external intercostal muscle. This is in contrast to the innermost intercostal muscles. Now this is the third layer. It's found on the inner side of the thoracic wall. And these usually pass from top to bottom, so they pass in a vertical direction. And the characteristic feature of the innermost intercostal muscles is that they cross more than one intercostal space. So, for example, you can have one starting at the third intercostal space and then passing down all the way to the sixth intercostal space. And it crosses all of those spaces as it passes down. Okay? Now, this is a segment that's been taken from the thoracic wall, and it's given you the outer layers of the thoracic wall. So you've got the skin, you've got superficial fascia. There's a couple of extra muscles here that we don't need to focus on right now. But this is one rib, and this is the rib that's below it, and then in between the two, obviously, you've got the intercostal space. And this depression at the lower border of the rib is called the subcostal groove. And you can see how you've got three layers of muscle. You've got the external intercostal muscle passing downwards and forwards, and then at an angle to it in the opposite direction passing downwards and backwards, you've got the internal intercostal muscle, and then the third layer, and then minho, the thoracic cavity, you've got the innermost intercostal muscle. Now, notice that in the subcostal groove, between the internal intercostal muscle and the innermost intercostal muscle, we have what we call the intercostal neurovascular bundle, which is basically an intercostal vein, an intercostal artery, and an intercostal nerve. So a neurovascular bundle is always those three structures. Okay? So like I said, those three are arranged in that order from top to bottom: the vein, the artery, and the nerve. The vein is found closest to the bone, and then the nerve is found at the very bottom with the artery in the middle. And they are located in the subcostal groove between the innermost and the internal intercostal muscle. So the intercostal spaces also have the intercostal vein, artery, and nerve arranged in that order from top to bottom. They are located, as I said, in the subcostal groove, which is found on the inferior border of the rib, between the internal and innermost intercostal muscle. Please make sure that you know these 3 points like the back of your hand, because we tend to ask about them a lot. Okay, now that wraps up what you guys need to know in brief about the thoracic wall. There are a few extra details, but I will be covering those in the form of an exercise so that you guys can go do some extra reading. Okay, so I'm going to wrap this video up, and I will see you in the next one.